Osteoarthritis is a common cause of joint pain and stiffness. Guidelines recommend treatments such as exercise and weight loss. However, we know patients can be reluctant to try these. The way a GP communicates in the consultation can encourage patients to engage with managing their own symptoms and influence how they feel about the likely outcomes of treatment. Research suggests that if a GP communicates with empathy in the consultation, in combination with being optimistic about the outcomes a patient should expect from their treatment, it has the potential to improve symptoms such as pain. Encouraging optimism is quite a new idea in GP consultations, as most of the evidence comes from experimental settings. We wanted to know more about patients' opinions on using this communication style in everyday GP consultations. For our GP practices, we recruited 33 patients with osteoarthritis to take part. We used written and video-recorded examples of GPs talking to patients about their osteoarthritis. 2 different examples were presented. One GP used an empathic, optimistic communication style, and the other used a neutral style for comparison. We then interviewed the patients about their views on each example. Patients told us that they think healthcare professionals need to consider the impact of how they talk and act on the believability of what they tell patients. Trusting the healthcare professional is key to ensuring that positive messages about what to expect from treatment are believed. Using positive language in the consultation can be acceptable, however, it must be realistic and relevant to patients to avoid conflicting with what they already thought or believed about their health. Time pressures and managing multiple problems could make this a challenge in real life, and this approach requires a fine balance to get right. Nevertheless, using this style of talking with patients could improve the communication of healthcare information that patients value and are likely to respond to positively by engaging more in their symptom management. The Empathetic research team have designed online communication skills training for healthcare professionals to support this use of communication in everyday practice. For more information, visit the University of Southampton Empathetic web pages.